thing is, COVID-19 is still a mystery.
That's right.
So it's really difficult to demystify what's actually still, we're still learning about. It's still a mystery. But there are a few things we do know about it. And I think knowledge obviously is power. When we know, then we can actually act appropriately, right? So knowledge is important. So a few things we've gathered so far. We know it's a coronavirus. Coronaviruses have always been here. They're one of the respiratory viruses. So yes, if you've looked at the back of some sanitizers and you've seen that this can take care of a coronavirus, it's because there are multiple different ones. What's different about this one is it's novel. Novel is another word for new. So new being, yes, there have been coronaviruses, but not of this different look, right? So because it's new, our bodies have never seen it. In other words, when something new comes in, it can do what it wants to do. Thank God for Jesus, it wouldn't for many of us, but it can do what it wants to do because we have not been exposed to it. And supposedly, we don't have the immunity to fight it because it's new. So knowing that it's a new virus is one of the more important things, right? Secondly, when viruses or infections happen, there are different levels of ability to be contagious. So say, for instance, we had the Ebola virus, right? Extremely contagious, extremely deadly. We have measles, extremely contagious. Now we have this, COVID-19, a coronavirus. It is contagious, but not on the level of the other two, but it's quite contagious, right? So one person gets infected, it has the ability to infect maybe about 3 people on average. So one, we've never been exposed to it. 2, it does have the ability to infect others on a rapid level. So far, what we know is, even though it infects people, thankfully, we recover from it. Most people so far that we have heard about, just by the numbers we have so far, since late last year till now, most people recover from it. So the mortality, meaning the rate of people dying from it, has averaged anywhere from 3 to 6%, depending on what population you're looking at. But that's still a high number, right? So that's another thing we know about it. So those are some of the perhaps facts, because the fact is still evolving. So 1, we've never seen it before. 2, it's quite contagious. 3, it does kill people. Now, who is more at risk? For a lot of infections, this particular population is more at risk anyways, more so one that they've never seen before, one that is contagious, and one that can kill. So who is at risk? The elderly. Now, elderly can be termed relative because some people are young and sick, old and healthy, right? However, just to keep the plane even, we're using cutoff of 60. So if you're over 60, we consider you more at risk. That's one. If you have chronic health conditions, so what are chronic health conditions? Diabetes. You have chronic kidney disease. You have, just things that you take medications for, and you have chronic medical problems. But really, it's diabetes, immunosuppression. So you take medicines that already makes your immune system weak. You're on chemotherapy. You have severe asthma. So those are some of the things that make you or the population at higher risk of contracting this disease. So some pregnant people are usually immune suppressed. So that's another vulnerable population. Usually, children are considered vulnerable. However, in this instance, we are seeing children display more mild symptoms. So they're not, thankfully, dying from this illness, but they do have the milder symptoms. What are the symptoms that we've established of coronavirus? Fever, cough, and difficulty breathing. Those regular respiratory symptoms. So fever, cough, and shortness of breath, difficulty breathing. So I did say children are, thankfully, not really getting harmed from this disease. But we also know that they now tend to be carriers of the disease. And who are those taking care of our children? Now that vulnerable population. We have grandma, we have grandpa, we have people with chronic kidney disease, diabetes, which is a high percentage in our population, who are taking care of these milder cases and then are getting to be at risk. So that's another fact. Children are healthier, however, they are letting people that are not as healthy be predisposed to getting sick from these conditions. So, it sounds like it should be scary, but I feel like if we know the facts that there's something novel, something new, something we've never seen before, something that can infect other people and get them sick, knowing that, we can then step back and say, how can we that are in this group or this group keep everybody healthy? So if you're in the older population where you can really get sick, what can I do to not get sick? What do I do if I have a symptom? If you're in the young group, how do I keep myself healthy and not get other people healthy? So knowing what the virus actually does helps us step back and do the right thing. So the current recommendation, as you all are seeing, some schools are closed, not because they have corona in their schools, but because they don't want that being contagious to spread, right? So what the numbers are showing us is every 2 to 3 days, the incidence we're seeing tends to be doubling right now in Houston. And that's because, one, we're starting to test more, two, because of the nature of the virus, right? So knowing that we could see more, we're stepping back and trying to do what we call social distancing, right? So the treatment we have so far is called social distancing. It's not a treatment, but it's one of our ways of mitigating this virus. Social distancing means, can you please stay home if you can? Avoid a reason to spread this virus. So they're advising against big groups, especially if you're over 60. If the group is going to be over 250, but more than likely, if you can, stay home. So social distancing is one of the ways that we've seen that flattens the curve. So you've probably seen a lot of curves out there, where you can either have this spike or you can have this trajectory, where you flatten the curve, where many people, even if they're going to get this infection, by the tail end of the season, hopefully it wouldn't have made people sick enough that they die from it, right? So social distancing means stay home if you can, stay home if you have a fever and a cough, stay home if you feel shortness of breath, stay home if you are in doubt. Anything that makes you wonder, should I really go out there, stay home. So that's one of the ways we have of not spreading this virus. If you do have those symptoms, call your doctor. Do not go to the clinic, because once again, we have the vulnerable population in clinic, right? Call the doctor. Many clinics have a triage line just for this. They would ask you the right questions and get you to where you need to be. If they listen to you, the nurse talks to you, and they say, check, 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 you need to be seen, we are waiting. We have preparations in place. We have things we have to put on, a room we have to put you in. We can funnel you through the right channel so we don't spread the possibility of this infection. So please call first. If you're experiencing really dire symptoms, you're really short of breath, you're confused, things like that, we would obviously advise you to go straight to the emergency room. But don't go to the emergency room and get the well sicker. Don't go to the clinics and get the well sicker. Call your doctors first. Now, for those that don't have doctors, we do have the Harris County Ask a Nurse line. So if you don't know the number, it's online, but if you don't know it, it's 713-634-1110. So yes, you can talk to someone and they can triage you appropriately. But the more important thing is, if you're not sick, stay home, right? So you don't catch it. If you're sick, stay home. If you don't know what to do, call your doctor or the nurse line. And stay home. Okay, so this is the time to love on ourselves. So, you know, the kids are driving us crazy at home, what to do. This is the time to learn and to love on ourselves more. But I think the best thing we can do for ourselves now is pray, 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 and be wise and stay home. Okay? Any other questions?
I've got a question.
Yeah.
So, with the black population, is there any advantage over?
So there's this thing out there. We don't even know the virus enough to make that correlation. I've heard about, you know, we're not as susceptible. This is a new virus. We don't have that data. So I will not say yes. Still do the right thing and the wise thing. Stay home.